you have more?
I got more. Okay. All right, you talked about some of the significant health problems that we're currently facing with our youth. One of them is inadequate physical activity. How is the health center going to counteract that?
Well, physical activity would be part of nutrition or wellness counseling. If the child had an identified disease, it would be the counseling. I'm hoping that, I'm optimistic actually that part will not be such a big deal now that we have the PEP grant. And we just reviewed yesterday the program with Dr. Castillo. Several of us went to the neighborhood to see how PE for life activities can change. So
and assuming that your answer would be the same for poor dietary habits?
I'm sorry?
I'm assuming your answer would be the same for poor dietary habits counseling?
Yeah, we would have nutrition.
Okay, that's fine. Then my other question is, this 111 reported pregnancies, where did you obtain that data?
From the nurses' annual report.
Which nurses' annual report? The high school?
Nurses for the district.
Okay, and what was our number for 07?
0708 is done, so I don't have a number.
Okay. And it says that 46% of the students report having intercourse. 46 out of how many?
That's in the state of Illinois.
That's from the state? Okay. I do not have that number. All right. 41%. When we talk about the high school students that are overweight, you said 41% of high school students surveyed. What's the number?
No, 41%
of surveyed students in Waukegan. That's not what this says.
No, it's what I usually say.
You're basing your analysis based on when they do the physical.
The physical, because at that time, kindergarten, 5th grade, and 9th grade is all recorded as a physical, so we got that data, that was the freshman
So that can be substantiated with that data right there.
Right.
Are you done with now? Okay. All right, I want to talk about laboratory services. Can you expand on that?
Laboratory services can test for strep throat, urinary tract infection, sexually transmitted diseases, pregnancy testing.
So we're back to the pap smears being done in the high schools. How else are you going to do a sexual, how else are you going to check a female for BDA and do a pap smear?
It's a culture.
Well, it's the same. How are you going to get there?
And that's if the parent agrees, if there's parental consent.
I'll give you an example of a school-based center that I happen to see.
Well, we're still going to be doing
Real nice
in
example.
the school even with the consent.
Can we let
Is that what you're saying?
I'm going to answer the question right now, based on the experience I saw at Evanston High School. They have, number one, you have to have parental permission to access the health care center. If you're going to be tested for any kind of birth control, contraceptives, or sexual disease, you have to sign another form that specifically indicates that that's going to be discussed between the health clinic and the student, and the parent has to sign it.
Okay, but we're talking about partnering with the Lake County Health Department, and they do not have such
And
a form.
here's the bottom line, we set the rules here. The Lake County Health Department isn't going to come in here and tell us what to do. We're going to lay it out how it's supposed to go, and that's up to the board. That's,
Okay.
no one's going to dictate to us.
Okay. Glad you clarified that. Thank you. Hold on, which, I know you said you're going to follow state and federal guidelines regarding parental consent, but then you also stated that there were certain ones that parental consent was not needed for. Can you expand on that?
In the case of abuse,
Of abuse?
medical people are mandated reporters. In the case of HIV testing, that is confidential, and pregnancy testing.
Okay. And then I had another question. This reimbursement for the FQHC, who receives that?
The county health department.
So that's not to our benefit at all?
Oh, it is to our benefit.
How?
Because as we would be billing for services. We would bill, if they have private insurance, we bill private insurance. If they have all kids or Medicaid, we would bill that. No one would be refused services because of inability to pay, but because the school-based health center has to be sustainable, it has to get revenue where it can, we will bill for all possible services. When you partner with an agency that has the FQHC status, that allows you to bill at 110% of the rate rather than 100% of the rate. So we would get more income by partnering with the Lake County.
So what would be our percentage of income that we're receiving from them?
I'm sorry.
Okay, so you're saying that they are going to give us half of that money that we're billing?
No, the school-based health center is a separate entity. Their money is not gonna flow through our district. Because right now, the grant money cannot flow through our district because we don't have the right qualification as a 501c3 subcategory. Right now, our grant money is flowing through Health Reach Plan. The funds are not commingled with the school district money. The final setup of the final configuration of services has not been yet set up. We're still waiting on options to see what is most beneficial to the school district and which service delivery system will allow the school board to maintain the largest locus of control.
And since we are